Okay.
Good evening, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, prostate cancer. Prostate cancer develops in man's prostate, the walnut-sized gland just below the bladder that produces some of the fluid and semen. It's the most common cancer in men after skin cancer. Prostate cancer often grows very slowly and may not cause significant harm, but sometimes are more aggressive and can spread very quickly. Let's unite to raise awareness about prostate cancer and its impact on the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of prostate cancer, today we have with us Dr. Avijit Kumar. Dr. Avijit Kumar is a renowned consultant urologist, laparoscopic and renal transplant surgeon from Kanpur. Dr. Avijit Kumar has rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very good evening to you, Dr. Avijit Kumar. Hope you're doing good, sir.
Good evening.
Good evening, doctor. And as September is celebrated or known as Prostate Cancer Awareness Month, we would like to first understand, doctor, what is Prostate Cancer Awareness Month? Why there is a need to have a whole month dedicated for the awareness of prostate cancer?
So worldwide, September, as you all know, is a month where we aware the patients about the conditions of the prostate relating to BPH, cancer prostate, as we will be discussing it today, prostatitis, which is another variant of infections of the prostate. Why is it important? As you rightly said in the beginning, that it is one of the leading causes of cancer in men worldwide. So what happens in foreign countries like in US or UK, that these people, the government has a screening program for these people who are above 45 years of age. So whether they have prostate cancer or not, once they get screened for it, most of them come to know that there's a high, the blood investigations will reveal suspicion of prostate cancer, and then they will get further investigated. Unfortunately, in our place, the routine screening, we try to implement it, we try to explain to the patients, but still it is not that active. Not all the patients, not all the men above 45 years of age won't undergo a repeat, a regular screening test by a PSA, or they won't visit a urologist until and unless they have symptoms related to prostate. So why this is important? It is important because, as you rightly said in the beginning, it's a very slow growing tumor. It is very much operable tumor in the early stages. And if it is well detected in time, if it is well managed in time, the patient leads an absolutely normal life. Patient will not have any symptoms, any problems pertaining to cancer as such, and he will lead a regular life if we detect the cancer in time. Unfortunately, whatever cancers we are seeing in our regular OPD basis, they are very advanced cancers. They are cancers which have already gone to other organs, which have already made the life of a patient debilitated or bedridden. So at that point of time, we can start treatment, but definitely that treatment will just be in the form of palliation. So it cannot remove the burden of cancer at that point of time. We can just provide him pain relief. That is all what we can do. So we need people to be aware when and what needs to be done, and how they need to be screened, and when do they have to visit a urologist.
So I'm sure the early it is diagnosed, the treatment is even more easier. Thus, the whole importance of awareing people about prostate cancer. Now, we all know, doctor, that after a certain age, because men have this gland called prostate, they do, develop something. The most common thing is enlargement of this particular gland prostate. Yes. Now, my question is, when because we are very much familiar with enlargement of prostate, but when it comes to prostate cancer, many of us are not actually aware of it. We would like you to make us understand what is prostate cancer.
Okay. So cancer, as you all know, it is unregulated cell growth, like it happens in any other cancer growth in the body. So prostate cancer is also one variant of that. So first of all, we need to understand that what actually prostate, as you already said before, it's a walnut shaped gland which is situated at the base of the bladder. And it is the growth of this prostate, it starts maybe after around 45 years of age. It is a phenomenon which all men will have in their lifetime. They will have some urinary problem related to prostate. 90% of the times it will be just a benign prostatic enlargement, which might present symptoms of benign prostatic hyperplasia, which is called BPH. So initially patients will say that they are having some problem in starting urination, or they are having increased frequency of urination, or they might be having burning sensation. They might feel that the urine flow like it was earlier, it is not now. Sometimes they might have even hematuria or blood in the urine. Sometimes they will have urinary tract infection because of. So there are variable symptoms, but then this is how it will present. So just by symptoms, we cannot say whether the patient will be having prostate cancer or not. Once the patient presents to us with these symptoms, we get a routine basic investigations, which includes a urine culture, which includes a serum PSA and serum creatinine, the routine test which we get it done for everybody. Apart from that, we do a digital rectal examination, which are with our index finger through the anal opening of the patient, so that we can we can know how the prostate feels in that patient. Now, these few tests and just one clinic visit to the urologist OPD will at least give us an idea whether the patient is a patient of BPH, he is a patient of prostatitis, or he is a patient of prostate cancer. So once the report comes, then we start the treatment, then we give the treatment to him. If the patient falls in the category of BPH, we will start him on medical therapy, and out of 188 patients will be the ones who will respond very well to medical treatment. They will have to continue these medications for a few years, and they will be absolutely fine with that. Another 10% of the patients will not respond to medicines. They are the patients who might undergo surgery. Among those 100 patients, there might be 2 or 3 patients who will be patients of prostate cancer. Once we make them aware, once we start understand what kind of cancer, what stage of cancer it is, we can either offer them medical treatment, we can offer them surveillance, watchful waiting, or we can just ask them to go ahead with a surgical treatment. So if we screen 100 patients, treatment advice, what needs to be done at that point of time. So yes, so I would tell what is needed is like all the patients, all the men above 45 years of age, at least once in a year, they can get an ultrasound examination, a digital rectal examination by a urologist, a serum PSA, and routine blood chemistries. These needs to be done annually. If there is any suspicion of anything else, then we can go ahead with the further treatment or further management or further investigations.
Right. So even if the sad news is that prostate cancer is very common, the good news is that it's treatable, and the early it's diagnosed, the more easy will be the treatment. That's what we are trying to emphasis on. Now the thing is, doctor, we would again like to understand what causes prostate cancer, why it happens.
So cancer, as you all know, there is no, we cannot say that there is any specific reason for cancer. Yes, definitely people who have family history of prostate cancer, they are likely to get prostate cancer. If apart from that, what increases the risk of cancer or any other cancer in our body is that a lifestyle which is not very active, a food which is rich in carbohydrates, or like we say, oily food, a fat rich food. These people are the ones who are more prone to get cancers in their body. Apart from that, patients who are having comorbid conditions like diabetes, hypertension, high BMI, these are the patients who are more prone to get prostate cancer. So we cannot specifically say a thing which we can consume or not consume and then not have or have cancer. It's very unlikely. But then we have to have an active, healthy lifestyle. We have to have regulated diet and a regular checkup, a regular screening, so that we come, if at all there are symptoms of prostate cancer, we detect them very early in it, very early in the beginning itself.
And what are the associated symptoms of prostate cancer, doctor?
So as such, there is no associated or a separate symptom of prostate cancer. But yes, patients will initially present, as I told you. The first symptom would be like they're having increased frequency of urination, or they might feel that the flow of urine is not as good as earlier. They might feel that they have to rush to the toilet to pass urine. Otherwise, they might leak a few drops of urine in their undergarments, or they might have blood in the urine, or they might have a burning sensation in the urination. So these are few symptoms how the patient will present initially to us. So once we get evaluated, then we'll come to know whether it is benign condition, BPH, or it is a malignant condition, that is prostate cancer.
Right. But the sad part is that, doctor, again, that, all men know that after a certain age, it's important to go for annual scanning or medical checks,
Yes.
etc. As you said, it's important to come, you just need to come once and get the scans, etc. done. And
we don't need a very high investigation. We just need a routine ultrasound examination, which is, I think, available in every street of our country, and we have an ultrasonologist available. So we just need to get an ultrasound examination, a few blood tests, maybe just 3 or 4, and a digital rectal examination by urologist. These are the 3 things which patient needs to get it done.
But the irony is that despite knowing that prostate cancer is very common, men normally don't go for annual checkups or scans, A. B. They, assume that, okay, see, I'm aging, so I'm bound to go frequently for urination or feel the urge, etc. So they associate all the symptoms and they'll just say it's because I'm aging. And they will never understand that there is a solution, right? So how do you, tell or advise your patients when they come to you that it's important to come to the doctor or the right person because it's treatable, even if it's not cancer, even if it's just the enlargement of the prostate, you need to get it scanned because it's treatable.
Yes, I think that is the whole purpose of our doing this program, is to make people aware that, first of all, as I told you, 90% of the patients won't be having any cancer. Out of 100, if we see 100 patients who are having urinary symptoms because of prostate problems, 90% will be treatable just by a single dose of medicine, which they have to take just once a day. So it is nothing beyond that. And you are absolutely right, patient, they think that what is happening to them is just because of their age, and they defer the treatment until the condition becomes so severe that they will come to us with high grade fever and then inability to pass urine, and they will come with retention of urine. I mean, they won't be able to pass. They will be in so much of agony and pain the time they present to us, that it is very sad that despite being so many physicians, so many surgeons available nearby, the patients only present to us in emergency when they think that now the condition cannot be looked after. Right. So from our side, we need to make each and every patient aware. What I do is we can have few pamphlets available, just to make them aware of that what are the symptoms are. If they feel that they have a few symptoms like this, they can just stick it in the piece of paper and give it to us. We can answer them. We can tell them that what exactly can the picture be. So now people are becoming aware. They come and ask themselves, they will come forward and ask questions that, sir, I'm having this problem. Can it be related to prostate? So yes, things are changing. People are getting more aware by newspaper, print media, by our YouTube and Facebook. So they are getting more aware, but then it will take time. Yes, it will take time.
Definitely. The whole purpose of having this session is only to spread awareness about prostate related issues, and specifically prostate cancer, as we are celebrating Prostate Cancer Awareness Month in September. We always do. So, Doctor, again, do you think, things related with urination, etc., is still a taboo and people are not ready to talk about it? That's why they don't come up with the problems, etc., and meet a doctor?
Yes, in a way, patients are actually a little embarrassed to come and discuss these problems. So we will have a few patients in our OPD who will actually be having, incontinence of urine. They might be leaking a few drops of urine in their undergarments. They will be keeping 2 or 3 cloths under their undergarments so that nobody comes to know. And then they will be so distressed about this condition that for them to come and explain what they are feeling, it's a huge task, because they will be so embarrassed and so humiliated about this, talking about this. So but then once you start treatment, patients themselves come and tell us that, no, sir, I am absolutely fine even after taking a few tablets. So this is one aspect. Another aspect is an aspect of erectile dysfunction, an aspect where patients feel that they are impotent because of the age, So, until and unless we come forward and tell them that these are the symptoms not related to age, but these are conditions which are treatable. Maybe just a few lifestyle modifications can help the patient get rid of the problem. Like, I'll quote a very simple example. Most of the patients which are in the age of 50 or 60s, they have a habit of drinking large amount of water in the morning. Now, once you tell them that this is actually not needed, that you consume 2 liters and 3 liters of water throughout the day, they are consuming 4 or 5 liters of fluids, and then they are rushing to the toilet again and again. So just a simple step of reducing the amount of water intake throughout the day is going to change the amount of times they go to the washroom. So this is a very simple thing which they can all do. And once they do it, they say, no, I don't need any medicines. I'm just, better with this kind of.
Doctor, just because you mentioned this, I'd like you to again, debunk the whole thing and make people aware about how much to drink. Normally in our society, it's a saying that you should drink a lot of water. And a lot has no limit. I mean, I've seen people drinking 4, 5, 6 liters a day. And again, as you said, in the morning, again, we have this habit of drinking at least 1 or 1.5 liters of water at one go. Now, how good or bad as a practice it is, plus how much water is adequate for us?
So, see, it's a very good question. The thing is, we cannot define an adequate amount of water for anybody, because amount of water intake is related to the body weight of the person. Apart from that, in what conditions we are living. Now, suppose we are in a place like, which is a hill station area. Obviously, the environment will not be that hot. So the requirement of fluid will be quite less. But suppose if we are in a very warm area like Rajasthan, Gujarat, where there is increased incidence of kidney stones, there the patient has to maintain an adequate urine. So how we can tell is, in patients in areas where there is very dry, arid and humid climate, we have to take fluid around 2.5 to 3 liters so that the body is not dehydrated. Secondly, if like suppose in our place, if somebody is doing a very regular physical work, he is into jogging and gymming and exercise. So these patients tend to lose a lot of water by sweat. Right. So you have to compensate, you can increase half a liter of water in your daily routine. What I advise to my patients is that in winters, you take around 1.5 to 2 liters of water. In summers, you take around 2 to 2.5 liters of water. This is the nominal amount of water, which you should take daily. Yes, if you are sweating out, if you are in the sun, if you are sweating out too much of fluid, you can increase your fluid intake accordingly. But people have a perception like morning they will take 2 liters of water, they will mix lemon. You can do all this, but it's not required. And this is a misconception that increasing the amount of fluid, it clears the body or it removes the body of all the unnecessary elements. It is nothing like that. So kidneys are there. God has given us 2 kidneys to filter our body completely. And it does our job. Our body has 70% of the body is fluids. So if our body weight is 70 kilograms, 49 kgs is just water in our body. So our body has adequate amount of water reserves to take care of the rest. We just need to maintain an adequate output, adequate urine output of around 2 liters. For that, we have to take around 2.5 liters of fluid. In summers, I think that is enough.
Okay. Now coming back to our topic, prostate cancer. Again, doctor, as you said, many people, doesn't come up with the issues that they are facing. Okay, maybe they are not aware of it, what's going inside, but at least they know that something is not normal, nocturia, getting up in the night a number of times to relieve themselves, or in the day again, frequency, urgency, etc. All the symptoms. They go through it, but they are just not speaking about it. They are suffering in silence. But what role their family members can play, because they are also, observing or seeing that their family member is in so much of stress, going to the urination, etc. so many times. But at least they can also play an important and vital role in counseling them and making them show up to the doctor.
This is a very apt question, because this is something which the family members will themselves notice. Family members, in fact, this is what they will tell us. There will be a 70-year-old gentleman who is rushing to the toilet maybe 3 to 4 times, 5 times, 6 times in the night. They are not able to sleep properly. this is one reason when, these old patients will go and they'll fall in the bathroom because they will be dizzy most of the time. They are not able to sleep, and they are embarrassed to tell to their children that they are leaking urine in their undergarments or in the bed. So, in fact, most of the family members, they will observe that, change in the behavior of, they will take more time in urinating. They will have stained undergarments. They will have to go a significant amount of times in the night, 4 to 5 times in the night to go past urine. They will be drowsy because they are not able to sleep in the whole. So this is something which they can watch for. They can ask, I think you can ask their parents that how many times are you going to pass urine in the night? I see that you are going frequently to pass urine. I find that your undergarments are stained. I find that there is, unusual smell in the clothes or in the bedroom where they sleep. So this is how they can ask them. They can make them comfortable. That shall we go and visit a doctor for that? Because see, my asking question directly to the patient will be more comfortable answering it to me rather than answering the same questions to their family members.
Sure.
So this is what family members can be aware of, and they can ask these questions directly to their parents or to their grandparents.
Right. So viewers, if you are, observing or seeing your parents going through the same, please, counsel them and bring them.
So specifically, if they find like the person is taking more than usual time to urinate in the washroom, if he's rushing to, this is something which you can easily make out. He has to go again and again. He is going to pass urine, running towards the toilet washroom. So I think this is what family members can understand, that these can be symptoms of related to prostate, not prostate cancer, but then they can be related to prostate. And then we need to, just see a urologist, just see a physician nearby to find out what the cause can be.
Right. The fact is, we all will age, at a certain point of time. And the thing is, we all will eventually go through these kind of phases. I mean, women also go through many similar things.
Exactly.
Only the reasons may be different, etc. Men also going through the same phase. As you said, it's very common. So almost all of us are having these issues. But the thing is that we are not confident enough, or we are not just, getting the courage to talk about it. So the whole purpose of having this session is to make you aware. Please talk about it. Please go to the right person, and don't just suffer in silence, is what we would like to tell. Absolutely. Now, doctor, we would also like to understand the treatment that is available for prostate cancer.
So first of all, we need to understand two things. How do we diagnose prostate cancer? And as we have talked about it earlier, that how to screen, how to know whether a patient is having prostate cancer or not. Right. Physical examination is one thing. Second thing is biochemical tests, which need to get. Most important is serum PSA. Serum PSA is its full form is prostate specific antigen. It is a product which gets released from the prostate, and in conditions like prostate cancer, in conditions like prostatitis, which is infection of the prostate, the PSA tends to rise. So if a person comes to us and we get it evaluated, we see the PSA is high. So initially what we need to do is we need to treat him with antibiotics. We need to give him some medicines and see whether the PSA is coming back to normal or not. So if 10 patients come to me with increased PSA, if I start medical treatment for all the 10 patients, out of 10, there will be just one patient whose PSA won't come down. And this is the patient who might be a patient of prostate cancer. So now suppose we have done all the tests and we have now a suspicion of prostate cancer for a certain gentleman. These patients will be advised to undergo a biopsy, which is a transrectal prostatic biopsy or a transrectal ultrasound guided prostatic biopsy. Now, this is where most of the patients will refuse treatment because somebody has told them that the moment you touch a tissue, you take a biopsy, it will spread like anything, and then it will spread to all the organs. It is very difficult to make the patient understand that, see, these treatments has been done after a lot of research. They have been formulated after so many guidelines, after so many treatment modalities have been made available to detect these tumors. So first of all is a test which I told you, PSA. If a PSA comes to be high, which is not coming down because of medical treatment, this is the one scenario. Another scenario is I do a digital rectal examination of a patient, and now I am in a suspicion that this patient might be a patient of prostate cancer. How will we proceed next? We will get a further advanced screenings tests which include an MRI test or a CT scan. Most likely we'll get an MRI scan done. MRI scan has a very precise, MRI gives a very precise information about the prostate gland. It will show its anatomy. It will show whether there are any cancerous nodules in the prostate or not. It will grade. There is certain gradings which are understood by us, by medical professionals, which will give an idea whether he's a candidate for biopsy or not. Now, if it comes that a patient is a suspicion of prostate cancer, we'll ask him to undergo biopsy. Once the biopsy comes, there is certain pathological gradings which is being done on all the specimens, which is called Gleason's grading. After that, after MRI imaging, after PSA value, after biopsy, now when we have all the information available, we will assign the patient to a risk category. So now, as you asked, what is the treatment for prostate cancer? Prostate cancer treatment depends upon the age of the patient, firstly, and the risk category of the patient. So just to simplify, I'll tell you how the risk category works. We have a category of patient who will be having very low risk prostate cancer, another category low risk prostate cancer, another category medium risk prostate cancer, then high risk, and then very high risk prostate cancer. So the treatment will depend upon the risk category of the patient. If it's a very low risk category patient, if the patient is a young age, 55-year-old male, I will advise him straight away, go ahead with a surgical treatment. Surgical treatment is called radical prostatectomy, in which we do a open surgery, laparoscopic surgery, or a robotic surgery, and we remove the prostate gland completely. So then further treatment, whatever happens is that patient will need a treatment which he need to follow up every 3 months to our clinic. Second category comes a patient when the tumor is a high risk tumor, where the tumor has involved the prostate and maybe a few adjacent organs. This becomes a high risk tumor. Then a very high risk tumor is one which has started spreading to different organs. So in simplified terms, a tumor which is localized to the prostate, we will go for radical prostatectomy. A tumor which has spread just to nearby organs, we have to evaluate whether he is a candidate for surgery or not. Thirdly, if it has spread to different organs, in these patients, surgical treatment won't be feasible. For them, we will give hormonal treatment or radiation treatment or chemotherapy, or there are multiple other drugs. So it's a huge, vast list of medication which are available. And in those patients who are very high risk or metastatic, as we say, who have crossed the limits of prostate and gone to every other organ in the body, those are the patients where we give medical treatment to the patients. So the treatment can be either surgical or it can be medical. I mean, in simplified terms, that depends upon the staging of the tumor. So that is actually a little vast topic to discuss, but then we have to understand surgery is an option available, medical treatment is an option available, but we have to stage and grade the tumor before we offer the treatment to the patients.
Exactly. और डॉक्टर ने जो बताया उससे यही समझ में आ रहा है, जो बात हम शुरू से कह भी रहे हैं, कि जितनी जल्दी डायग्नोस होगा उतनी जल्दी और उतना आसान जल्दी आपका ट्रीटमेंट हो सकता है। इसलिए अगर ये सिम्टम्स हैं और आपको नहीं पता कि क्यों हो रहे हैं, please don't associate these symptoms with your aging, etc. Go and consult the right person. Urologist is what you need to seek help from. कुछ हम सवाल भी हमारे व्यूअर्स के लेंगे। डॉक्टर आलेख दीक्षित का सवाल है, A loved one was diagnosed with prostate cancer about 12 years ago and did not want any treatment. He is now in his 90s and his PSA has risen from 24 to 98 in the past years with few symptoms. Does this mean his cancer has advanced?
So yes, Mr. Alek, this is a very nice question, and we have seen a lot of patients coming to us with this scenario. So before I answer this question, let me tell you, like, suppose there is an 80-year-old gentleman who comes to us and I do all the battery of tests on him and I find out that he is a patient of prostate cancer after doing a biopsy on him. So if patient does not want any treatment, we can still do an option of watchful waiting, which is a well-acclaimed treatment. And in this, we yearly follow the patient. We tell him not to take any treatment. We yearly ask him to follow. We do a repeat biopsy once in a year. We do a PSA check once in a year. We do rectal examination once in a year. We try to find out at what point of time does the tumor starts aggravating. Like as you said, his PSA was 24 1 year back, and now it has risen to 98. Yes, this is a very significant increase in PSA value. If we can just do a few tests and confirm that this is because of prostate cancer, and we start him on some medications, he will not need any other treatment beyond that. At 90 years of age, we anyways do not ask the patients to get a very advanced or very high-end treatments, but just a few treatments can be given on him, and his prostate cancer must be controlled by these medicines. But this is an indication that the cancer might have advanced, but then without knowing the exact, biopsy report and all these things, I cannot say. But then yes, it does mean that his cancer might have advanced or might have spread to any other organ.
Right. So Alek, please take the person you're talking about to the right person, to the urologist, and they'll be able to, after scanning or go through the reports, will be able to tell you कि अब क्या करना है. अनिल पाराशर पूछ रहे हैं, प्रोस्टेट में क्या परहेज करना चाहिए?
तो परहेज, देखिए पराशर जी, मेन चीज जो जैसे हम लोगों ने डिस्कस किया कि एज सच कोई परहेज कि हम क्या उसको होने से रोक सकते हैं, तो ऐसा बिल्कुल भी नहीं है, क्योंकि वो हमारे शरीर का एक अंग है जो बढ़ना चालू हो रहा है और वो कुछ ना कुछ किसी ना किसी तरीके की दिक्कत जरूर देगा. तो अगर हमको परहेज करना है तो जैसे हमने बताया, आपको एक्टिव अपनी हेल्दी लाइफस्टाइल रखनी पड़ेगी. 30 से 40 मिनट्स के लिए आपको रोज वॉकिंग करना चाहिए. वो खाना जिसमें बहुत फैट कंटेंट है या बहुत हाई कार्बोहाइड्रेट कंटेंट है, उनको अवॉइड करना चाहिए. पानी बहुत ज्यादा नहीं पीना चाहिए. और सबसे जरूरी चीज जो नॉर्मल वेलबींग के लिए है, वो ये है कि सॉल्ट का इंटेक और शुगर का इंटेक हम लोगों को बहुत कम रखना चाहिए. हम लोग की इंडियन डाइट कार्बोहाइड्रेट रिच डाइट है, हम लोग की इंडियन डाइट फैट रिच डाइट है, हम लोग इंडियन डाइट हाई सॉल्ट इंटेक की डाइट है. ये सब चीजें हम लोग को परिवर्तन करना पड़ेगा. अगर कोई भी ऐसा सिम्टम जो कि पेशाब से रिलेटेड आपको लगता है और आपकी एज, उस एज ग्रुप में आप फॉल करते हैं, तो आप जरूर आइए, जरूर मिलिए हम लोगों से, और हम आपको यही गाइड करेंगे कि उसमें हमको आगे क्या करना है.
राइट. राहुल जौहरी भी सिम्टम्स से रिलेटेड ही उनका भी सवाल है. What symptoms did you have before going to the doctor to find out you had prostate cancer?
So no symptoms, as I told you, increased frequency of urination. If you have a sudden urge to go and pass urine and you feel that if you don't pass urine you might leak a few drops in your undergarments, if you feel that the flow of urine is very low, when you are passing urination it is just falling near your legs. If you have to strain to pass urine, if you have to if you find that you leak a few drops of urine in the undergarments, if you feel that you are having burning sensation in urination, these are the warning signs when you have to find out that there is something going on which is not right and you need to see a doctor. Once you come to a doctor, he will examine you, write a battery of tests, and then tell you whether you are a patient of prostate cancer or not.
महेंद्र सिंह का भी मिलता जुलता सवाल है. प्लीज बताइए कि अर्ली वार्निंग साइंस ऑफ प्रोस्टेट कैंसर क्या है? आई एम श्योर यही जवाब आपका होगा जो आपने अभी दिया. बिल्कुल. तो यूरिनेशन से रिलेटेड कोई भी तकलीफ है तो उसे छुपाइए नहीं, प्लीज अपने डॉक्टर को दिखाइए. प्लीज घर वालों को तो जरूर बताएं, और घर वाले भी जो उनका एक इम्पोर्टेंट रोल है वो जरूर प्ले करें. अगर आपको लग रहा है कि आपके परिवार के लोग जो है बार बार वॉशरूम जा रहे हैं, रात में बार बार उनको उठना पड़ रहा है, तो प्लीज आस्क देम टू और टेक देम टू द राइट पर्सन, दैट्स अ डॉक्टर. नाउ डॉक्टर, एज वी हैव ऑलरेडी स्पोकन अबाउट द ट्रीटमेंट पार्ट ऑफ प्रोस्टेट कैंसर, आई वुड आल्सो लाइक टू अंडरस्टैंड व्हाट काइंड ऑफ follow-up treatments are there. For example, कोई है जिनको प्रोस्टेट कैंसर था, ट्रीटमेंट हो गया है, वो ठीक है, लेकिन आगे किस तरह की लाइफ को जी पाएंगे और फॉलो-अप ट्रीटमेंट कितना इंपॉर्टेंट रोल प्ले करता है?
तो जैसे बहुत सारे पेशेंट्स हम लोग के हैं जिनकी हम लोग सर्जरी करते हैं, रेडिकल प्रोस्टेक्टमी करते हैं, उनका प्रोस्टेट ग्लैंड निकाल देते हैं. इन पेशेंट्स को हम लोग 3 मंथ्स के फॉलोअप पे बुलाते हैं. हाँ, अनटिल अनलेस उनको कोई सिग्निफिकेंट प्रॉब्लम होती है तो बीच में भी आ सकते हैं. हाँ. नहीं तो हम लोग एक सिंपल सीरम पीएसए का ब्लड टेस्ट कराते हैं और 3 महीने में फॉलोअप करते हैं. अगर पीएसए का राइज ऑपरेशन के बाद होता है तो फिर हम फर्दर इमेजिंग स्टडी जैसे कि पेट सीटी, जैसे कि एमआरआई स्कैन या सीटी स्कैन, वो एडवांस टेस्टिंग है, वो कराई जाती है. तो फॉलोअप बड़ा सिंपल रहता है, चाहे हम लोग मेडिकल ट्रीटमेंट करें या सर्जिकल ट्रीटमेंट करें. एक सीरम पीएसए का ब्लड टेस्ट, एक पेट सीटी जिसे हम लोग आजकल एक कहते हैं पीएसएमए पेट सीटी, बहुत एडवांस इमेजिंग है. ये बताती है कि जो कैंसर है वो प्रोस्टेट के ग्लैंड तक सीमित है या किसी और ऑर्गन में फैल गया है. अगर फैल चुका है, हम ट्रीटमेंट कर चुके हैं, तो क्या वो रिग्रेस होना चालू हुआ है कि नहीं हुआ है, कि वो बढ़ रहा है पहले से हमारे ट्रीटमेंट देने के बाद भी। तो यही 2-3 टेस्ट हैं जो हम लोग फॉलो अपने पेशेंट्स का करते हैं और उससे डिटेक्ट करते हैं कि हमें कोई ट्रीटमेंट चेंज करना है, हमें कोई मेडिसिन चेंज करनी है, कि वही मेडिकेशन पेशेंट को देते रहना।
Okay. And another very common question that people often ask is, can a man survive prostate cancer?
So that's a very nice question. So what I'll tell you, what book says that suppose a man is diagnosed with prostate cancer, from the point where it started, it takes around 13 years for prostate cancer to start spreading to the body. So we have a very huge time log where we can detect the prostate cancer and even prevent it from spreading. Once it spreads, once it starts spreading, obviously the lifespan goes down because now it has taken place in many other parts of the body. So the most important thing is the patients will, the prostate cancer most commonly spreads to the bones. It is very fond of bones. It will spread to the axial skeleton. It will spread to our spine. It will spread to the long bones of the body. So I will also like to discuss a scenario where an old person, he is brought to an emergency where he has a fall in the bathroom. We have found that he has got fracture in the hip joint. Mm-hmm. The orthopedic surgeon does his work. He gets a routine evaluation and finds out that the PSA is quite high. So he might be a patient of prostate cancer who has spread to the bones and made the bones very brittle and fragile because of what? He has developed a fracture. So it is a very slow growing tumor. That is why we have so many treatment options available for this tumor. Not a very aggressive tumor, but yes, we have to detect it quite early. We have to find it out before it starts spreading to other organs and start the treatment at the same time.
Right. And doctor, before we sum up the whole session, any take home message for our viewers?
Yeah, definitely. Take home messages like all the men above 45 years of age, don't shy away to discuss your problems relating to sexual life. Don't shy away related to discuss your problems regarding urination, because they are very much treatable. They are very much understandable, and 50% of the times, just by doing a few lifestyle modifications, you won't need any medications and you will be absolutely fine with that. Apart from that, have a very healthy lifestyle. Avoid fatty and carbohydrate-rich food. Avoid salt, avoid sugars, and do exercise. And whenever you need help of our urologist, do visit them.
Definitely. Do not suffer in silence. Don't associate every symptom with your aging. Aging can be beautiful. Aging can be painless. Please consult your doctor in case you have any trouble, any symptoms. And yeah, of course, an annual checkup is what you need to do after a certain age. Thank you so very much, Dr. Avijit Kumar, for your valuable time. So it was wonderful talking to you. It was quite an informative session for our viewers. Thank you.
Thank you. Thank you so much.
We really look forward for many more such sessions on various topics with you in coming times. Thanks. Thanks. And viewers, thank you for an excellent participation. For more information and updates, stay connected to our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram.